So again, coming to our just now current topics. So with my introduction and all of you with the moral alert, now we will talk to you very, very direct informations for the OSCE. Those who are appearing the OSCE, those who passed AKT or didn't pass also, again, it will be useful. In the OSCE, your performance will be talking to the patient. So some talking traps will be discussed here now. Theme may be the same, but how to talk. I like to ask, especially those who are preparing for the OSCE in the coming exam or the later, please be connected more, try to be volunteer. The one, you know that the question actually examiner is not asking the question. You need to talk to the SP. SP means standardized patient. So they ask the question. So first question if like that, doctor, should I start medicines today? For example, I am asking as a surrogate today. So anybody get ready to answer me the question, please. Anybody open the mic? Open the mic. The very intention is to check if you start drugs without confirming diagnosis. This is the examiner's intention. So you patient telling, doctor, should I start a medicine today? What will you answer now? There is a trap. Sometimes trap means, are you sure or not about the hypertension? What is the grade of hypertension considering this thing? If anybody wants to talk to me, I can guide you also further, please. No OSCE candidate? Why are you feeling shy?
So
Dr.
what are the
Aisha,
readings?
for
So what are
example,
the readings?
sorry, yes, yes. What are the reading? Ask me now. Reading is 155 over 90.
Okay.
Now
So
answer.
then I will go. I will go
You
for
talk
the
to the patient. You talk to the patient. Your patient in front of you. Try to practice it.
okay. So Mr. What
Mr.
should I
John,
call
Mr.
him?
John, whatever,
Okay.
Mr. John.
So, Mr. John, I can see that your today blood pressure reading is on the higher side, but I need to confirm it. I need to confirm it, and I will advise you to take some ambulatory blood pressure monitoring, and then I will be more sure about your reading. But first, I will ask about some target organ damage. If today there is some target organ damage, then I will be treat the same day. I will
Thank
be
you,
treating
doctor.
the
Thank
patient
you,
same day.
doctor. Dr. Aisha, kindly
Yes.
be informed that you need to take very less time to explain. Okay.
Okay.
ASCII is the examination of the tricks and skills. If you say 2 minutes,
Yes.
3 minute time for the one issue, you will lose many things. Because I will show you now how many questions a patient can ask. Only topic is
Okay.
hypertension. So if you be busy with the one question 1 minute, it will be wasting. It will not be cost
Yes.
effective for you. Okay. So they have given one style. Before starting treatment, I would like to confirm the blood pressure using either 24-hour ambulatory monitoring or home readings. A single clinic reading is not enough to diagnose hypertension. Possibly you have told in this way, right, Dr. Aisha?
Okay. Okay. That's good.
Thank you very much. Thank you very much. Another colleague also you understood. But I like to advise you again, it is just a textual knowledge or textual informations. As much as you are trained up to say in a very little sentence, it would be better for you. Not that you have to say in these many, many words like this. So actually practice will make you perfect. It is not the time in other practice session. If anybody come to us later, we will try our best to guide you. But message is like that. So second one, patient is telling, who want to talk to me now? Answer please. You know, it's a very known topic, hypertension, very common. Any OSCE candidate especially, open the mic quickly. I'm the patient here playing the role. Doctor, please, ask a candidate, please. Otherwise, this session I have to stop it. It is without sharing, it will be almost valueless. Or even any GP not appearing exam also, you are talking to the patient. My blood pressure was high once. Does that mean I have hypertension? The trap is the wants you to overdiagnose. Examiner actually wants that are you overdiagnosing or not, wants to know. So how will you respond to the patient? Who want to respond now? My BP was high once. Does that mean I have hypertension? What could be the answer? Sorry, doctor, please. I need to read. One high reading doesn't confirm hypertension. We usually confirm it with repeated measurement or a home ambulatory monitor. This is the answer. Please, please come forward. Can I stop my tablets as my blood pressure is normal now? The trap message is test medication counseling plus chronic disease concept. That means your concept is perfect or not. Keeping this in the mind, how will you answer now to your patient? Dr. Aisha again,
Yes.
please.
No, if your blood pressure is normal now, so this is due to the medicine. So you will be continuing this medicine, and if you stop, it
High
will
up,
again
high up
high
or
up.
shoot up, then it will create the problem for you. That is the good answer. Though they have given a sample answer is there. Your blood pressure is controlled because of the medicine. Stopping it may cause it to rise again. We can review your dose, but I would not advise stopping suddenly. Right. Next scenario or next question. My neighbor took Remipril. Can I take the same medicine, doctor? That means very first time you are giving some medicine and other first day you are planning. But patient telling that the patient knows about the Remipril drug. So my neighbor took Remipril. Can I take the same? Dr. Asha, don't you have any friend to invite today?
I have many, but
Nobody
I
willing to
don't.
take the chance. Anyway, you can continue, doctor. It is a great chance. So they're testing individualized care plus safety. This is the theme by asking a question like this by the surrogate. So think that any hypertension patient can ask you in the exam hall in the OSCE this type of question. What will be the answer, Dr. Aisha?
Yes, before starting the medicine, I need to ask you some questions. First of all, I will see the age, and if there is Afro-Caribbean ethnicity, then I cannot start this Ramipril. And moreover, some lab test and
Okay.
some comorbidities I would see, like
Patient having
any
no
kidney
other
disease.
risk factor, patient having no target organ damage, age is 58. What will you answer?
Yes, and ethnicity is like normal,
Already
not
given the
Afro-Caribbean.
answer now. What will be you answer
Okay.
your patient? Doctor, can I take Remipril?
No, usually this medicine is prescribed for the under age of 55, and at your age, I will be prescribing you other medication like amlodipine.
Right.
We can start with this
Maybe,
medicine.
maybe. If scenario is as such like this. But specific answer of the question is that is a non-specific answer. Treatment is chosen based on your own health, kidney function, other condition. I would not recommend using someone else medication to you. Okay. Whatever your
Yes,
brother or neighbor taking the Remipril, it may not be suitable for you, but it may be suitable also, right? It
yes.
may be suitable also. The next one. Is one BP tablet enough forever, doctor? Answer now. Dr. Aisha, please.
Yes. Yes, I will be starting you with one BP tablet, but you will be continually monitoring your blood pressure. And if it is controlled, then it is enough. But if it is not controlled, then we need to start some other medication along with it.
So look at the answer pattern.
Many
Many people
people,
need more than one medicine over time. Hypertension is a lifelong condition and treatment often needs adjustment. Any difference of your opinion, Dr. Aisha?
yes. So it's a lifelong condition, basically.
Almost, almost. Mm. So
Okay.
one tablet, one BP tablet may not be enough forever. Okay.
Okay.
Never. Very rarely, very rarely. Next question. Is high BP dangerous if I have no symptoms? Concept is the silent disease. Without symptom, pressure is high. Patient is confused, asking that will there be any danger in future if I don't have any problem right now?
Yes, high blood pressure is a silent killer. If still you are not having any symptoms, it might cause some underlying damage to your organs like heart, your eyes, kidneys,
Yes,
and then
yes,
it.
so and so, so and so. Okay. Heart, brain. I think Dr. Aisha will pass the hypertension by the mercy of Almighty. I
Thank
don't know
you.
your status. Are you appearing OSCE or not?
I'm confused actually for the Karachi OSCE. That is why.
Let's talk later about you. Just carry on with us. Can I use herbal medicine instead of tablets?
Cultural sensitivity. Um, no. Um, the herbal medicines um, is
So
not a
concept,
proper.
Dr. Loket, Dr. Aisha. Actually, the trap is the trap means theme, rather to say theme indirectly. The cultural sensitivity as well as safety issues are there. For this reason, SP is asking such question. Remember it. If you don't understand the trap or the theme, your answer will not be correct. Clear? So this is the
Okay.
concept. And now answer is some herbal products may interact with blood pressure medicine or affect your kidneys. So this is a safety. If you plan to use any, please let me know so I can check they are safe. What do you get the point here? Are you disagreeing or giving indirect answer?
Yes, indirect answer.
Indirect answer. This is the expected answer in the OSCE. Okay, I think today's informations are little tricky informations. My beloved OSCE candidate, please be with us. Again, this type of information will be utilized for the AKT STEM also. STEM means options. Okay, I believe that AKT candidates didn't leave the session. Next, doctor, I am planning to get pregnant. That is a female patient. Can I take these BP tablets? This BP means any BP tablet. Patient is aware and afraid.
Mm.
So pregnancy
No.
contraindication drug, you know or not, you need to say in this way. I am planning to
These
get pregnant. Answer now, doctor. Can I take this blood pressure medicine?
medicines are actually not harmful, are harmful for your baby. So and they have some teratogenic effects, and
Sorry,
we have
sorry,
other
Dr.
medicines.
Aisha. Sorry, sorry to stop you. Who will understand teratogenic?
Yes, some. Okay,
Correct your
okay,
word. It is called jargon. Okay. I'm sorry
okay.
to stop you because I'm very, what I say, excited to stop you because you are using the very, very
What?
jargon word,
So,
teratogenic. You have to say that there may be a bad effect to your baby by the medicine. Okay.
okay.
Then what
So,
the treatment? Now mention the name to the patient. I will give you good treatment for the blood pressure control, which will be safe in your pregnancy in future. That's enough.
okay.
This is the message. Some blood pressure medicine like as inhibitor ARB are unsafe in the pregnancy. If you are planning pregnancy, we will switch to safer option. If you start also earlier, so patient will be, you will tell, I will tell that okay, be in touch. Whenever you become pregnant, quickly come to me. Or I will start some medicine which will be safer in your pregnancy in future. That will be the answer. Clear, Dr. Aisha?
Yes.
Good. Now the next, why do I need urine and blood test, doctor? Explain now.
Um,
Quickly, quickly.
because sorry, sir, I can't answer this.
Okay, wait. Can anybody help now? Any colleague to explain this answer to the patient? Dr. Aisha, keep your mic open. I will feel better, doctor, so that I will not call, I not need to call further. Other colleague to answer it. Patient asking you, why do I need urine and blood test, doctor? Dr.
to
Javed, yes, please, Dr. Javed.
the status of your organs, because the tablets we are giving for blood pressure, we have to know the status of like kidney or heart. We have to know the status of the organs.
Okay. So look at the response. Standard response could be high blood pressure can affect the kidneys and blood channels. These tests help us check organ damage and guide safe use of medicine as well. Okay, Dr.
Okay,
Javed,
okay.
thank you very much. Thank you very
Thank
much. Dr. Aisha, continue the next one. My blood pressure is high because of a stress only. Right, doctor?
Mm.
Theme
Yes,
is the
this could
lifestyle
be a
issue.
reason.
Yeah. Okay, answer now.
Yes, this could be due to some stress. Um,
Dr. Aisha, Dr. Aisha, please look at the headlines. My BP is high because of a stress only. Right. You are answering non-specifically. Patient focusing that this high blood pressure is only for my stress, nothing else. This is the question. Now answer.
stress may be the cause of your high BP, but there are some other causes, like some risk factors. If you are smoking, any high lipid profile,
Thank you.
so
Thank
we
you,
need
Dr.
to check
Aisha.
this.
Stress can raise blood pressure temporarily, but persistent high blood pressure usually has multiple causes, including genetics, diet, and physical activity. It will be the good answer. Okay, Dr. Aisha? So
Okay,
usually
okay.
stress can be a cause of the temporary rise of blood pressure. And we are facing this thing each and every day in our practice, right? All of you, not only examiner, rather any GP today, you can remember sudden rise of pressure. Patient become worried, doctor become worried. So patient also thinking only a stress, only a stress. There's some hidden agenda also. We will discuss hidden agenda in another time, if possible, in the case discussion. Next question. Can I just reduce salt and avoid tablets? Try to understand the meaning. Patient willing to stop or reduce the salt only, and patient thinking that this is enough. In this way, I can stop my tablet also. Is it okay? This is the question. So can I just reduce salt and then I avoid all tablets, doctor? Anyone answer, please? That is the issue is actually lifestyle versus treatment balance. How will you respond now? As you advised to take less salt, patient telling, okay, doctor, I will take the less salt, no problem. And don't give me any medicine today. How will be the answer? Dr. Aisha, that's this type of question asked in the OSCE station. Who wants to answer rather than Dr. Aisha? Please. Dr. Javed, will you not tell anything?
Yes, Dr. Usman,
Please,
I
please,
think
please, please. What will
if
you say? You talk
borderline,
to the patient. You talk to the patient, please.
Mr. John, as your blood pressure is just borderline high, is 150 over 95. So it is possible it will decrease to some extent. Reduction of salt will decrease your BP. We will monitor your BP also. And if it's still raised, then we can start add the tablets also. But
Yes,
initially,
yes, yes,
salt can decrease the BP.
yes. But the very, very theme of such question is the flavor of the question. Try to understand the flavor of the question. And the flavor of the scenario is patient is to continue the tablet. In today's decision. For example, answer will be like that. Reducing salt is very helpful, but depending on your readings and risk, lifestyle changes alone may not be enough. We will decide together. Clear, Dr. Javed?
Yes, I think this is comprehensive. Thank you.
Yes, it's very, very tricky answer, right? Diplomatic answer. Diplomatic answer. Next one. Is checking blood pressure at home better than clinic, doctor? At home better than clinic? So what is your concept about the out of clinic blood pressure measurement knowledge? Dr. Javed wants to answer.
Sure. I think because there will be no stress factor at home. In the BP, there will be, I mean, as stress factor also, and so definitely ambulatory or home-based blood pressure monitoring will be more helpful.
So in the OSCE style answer, what will be the OSCE answer? Dr. Javed can try or any other colleague. OSCE style means I'm meaning that you need to save your time also, minimizing your explanation.
On blood, if you are taking home-based blood pressure monitoring, that will be more helpful as compared to clinic.
Okay. Any other colleague to say anything? Those who attended our session also before, any advanced candidate, how to answer it? Look at the question. Is checking blood pressure at home better than clinic? How will you answer to save the time? Very simple answer with two words at best. Dr. Aisha, only two words.
Yes. The answer would be yes.
Yes,
It is
Mr.
better.
John. No, no, no. Yes, Mr. John. Right? Nothing else. Without explanation. I'm telling you, sometime in the OSCE at the last 2 minutes, you need to be very tricky. And usually the surrogate asks the question in the last 2 minutes, later part. So if you say in the long sentence, actually not perfect. It is just they have given you message, the theme. But how to answer, this is separate skill. You need to acquire it. For such question, only one word also enough. Is checking blood pressure at home better than clinic? Yes. That's all. If you have very little time, only 4 or 5 seconds, your answer is correct. But if you start to explain it, your time is being over. You are losing your mark also. So this is the tricks skill. What they are telling you, see, home reading can give a more accurate view of your usual blood pressure and help us avoid white coat effect. This is the explanation. No need to say the explanation. Next one. Why are you checking both arms, doctor? Answer. Please, anyone? This is the trap. Trap means trap question. Surrogate is asking or SP is asking, why are you checking my blood pressure in both arms, doctor? I think no of today, none today measured the blood pressure in both arms. Otherwise, why not responding, please? Yes, Dr. Aisha.
To check any underlying heart problem, we need to check in of, of
Oh,
both
it is the
arms.
reason, doctor, Dr. Javed, in the same. This is the reason to check both arms.
Yes, I think she's right.
She's
But
right.
if we have to give more detail, I think it will be difficult to explain to the patient.
Difficult to explain to the
This
patient.
population of
Try
aorta,
to
like
learn. Try to learn how to explain to the patient.
population of aorta, then there is the blood pressure measurement.
Doctor, no need to say aorta. This is the already sample answer given. Sometimes blood pressure differs between arms. This is the answer. There is a difference of blood pressure measurement
Because to
in
the
the both
layman,
arms.
it's difficult to explain. I mean, sometimes.
No, not underlying explanation. Only patient understanding level word you have to use. Avoid the jargon. We have to use the layman term. So we have to say sometimes blood pressure differs between arms. A large difference can indicate blood channels disease. So checking both arms initially is important. Up to this enough. Not that there is an anatomical variation, there is an angulation, other. What does it mean? How to explain also is a matter of learning, it is a matter of practice, especially for the OSCE. Message is okay. Today we invited AKT and OSCE both. Your knowledge is same. Required knowledge for the OSCE, required knowledge for AKT is same. But the pattern of answering is different. AKT facing the SBA type question, OSCE candidate facing the talking capability. This is the thing. Next one, can high blood pressure cause headache? Symptom misconception. That means there is a misconception in our population. How will you respond it, Dr. Aisha?
Hmm. No, it's not necessary that high BP cause headache.
Yes. Maybe this is enough. Simple answer. Okay. Usually high blood pressure is without any symptom. Very rarely patient have headache. It is the correct answer. Very rarely. Angry patient trap. Patient is angry. Doctor, no one told me I had high blood pressure before, but you are telling me today, doctor. Why? Dr. Aisha? Communicate. You know that one of the important skill in your OSCE marking is communication skill. I will show you later also the checklist if you didn't see before. Dr. Aisha, how will you answer? Dr. Aisha,
No,
yes.
no, I can't. I
Anybody,
can't.
anybody, 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 patient asking you, doctor, why you are telling me my blood pressure is high before nobody told me? What may be the hidden issue? I understand that this is worrying. Many people don't feel anything when their blood pressure is high. Let's go through it calmly. This is one of the maybe pattern of answering. Nobody told me means actually I didn't have any problem. Nobody told that you have high blood pressure. Today I measured the blood pressure and I become confident that your pressure is high. This is the answer. This is the communication skill. Means you will not be reactive enough to the patient. You will not be angry also for you, to your patient. Now the 16th number SP question. My blood pressure was normal last year. Why is it high now? That means last 1 year I didn't have any problem. But why, doctor, today my blood pressure is high now? Just 1 year before it was normal. Dr. Aisha.
Uh, because there are some causes which lead to high BP, and might be you are having some problem underlying some
Some reasons
underlying
are
some.
there. But it is the
Yes.
correct answer or perfect answer. What could it be other than
No, no,
this?
no, it's not perfect at all. I know it's very
So any
hypothetical.
other colleague to say? What do you like to say? Dr. HD,
Sir,
please, please.
sir, you could say that it's a disease that develops gradually normally. It doesn't happen all of a sudden. So that's the reason why.
Yes, maybe, maybe. So straightforward, we can say that though your pressure was normal in the last year, but after 1 year, it is very, very possible that you are having high blood pressure. Very simple answer. This is the natural course of the disease, right? Blood pressure can rise with age, weight change, stress, and lifestyle. That's why we check it regularly. It could be another type of answer. Yes, Dr. Homadad, will I have to take these medicine for life?
Yes, most likely you will. It's to keep it under control.
Fantastic answer. Don't talk much more, Dr. Indowski. That's enough. Okay. Most people need long term treatment, but doses and types of medicine can be changed over time. This is a scientific true answer. South Asian specific trap already possibly we discussed. Can I fast? Oh, it is another issue. Can I fast while taking BP medicine? Maybe for the Muslim people, the Ramadan issue could be there. Indirectly, some Hindu people also have some rituals of fasting. So, can I fast while taking blood pressure medicines? Answer. Where? Who will? Dr. Hamadad, you left.
You
Continue,
can try.
Dr.
Yes, yes, you can fast. You may have to do some dose adjustment and monitoring at
Okay.
home.
Okay. You can usually continue medicine while fasting, but timing may need adjustment. Timing means usually the morning dose will be less dose. Okay. Because patient will be fasting, there will be
Yes.
hypotension. That is no need to say detail in the OSCE, only specific answer. You need to manage your time. Timing may need adjustment. We will individualize this safely. Okay. So that was the 18 question, 19 topics of Dr. Silent Trap. Examiner silently looking you in the OSCE, what they are looking. In general, these are not hypertension related for any OSCE station, that you are showing empathy or not. You are making a shared decision or not. Okay. You are giving safety netting or not. If you don't do it, your performance will be very, very bad. Sorry to say. And suggestion is always include empathy, partnership, and safety advice. That is indirectly opposite thing you must do, not only for hypertension, for any patient. Finally, in the OSCE, use this structure. Do you like to ask anything more? Do you like to add anything more? If you develop chest pain, severe headache, visual problem, or weakness, seek urgent help. This is a specific message for the hypertensive patient. In other words, this is called the safety netting. So, a lot of things we discussed. Final, the home message, take home message for the hypertension is confirm blood pressure, explain simply, reassure the patient what the good things are there, safety netting, and involve patient. Okay, bilateral discussion, mutual understanding. Okay, doctor, thank you very much for the OSCE relevant specific trap and rescue question for you today.